Today I'm going to talk about interferential current, and I'm actually going to do a treatment of a patient with IFC. On number 4 on your scenarios, the patient is a 17-year-old male with a healed inversion sprain of the left ankle. Injury occurred 6 weeks ago. He has chronic edema, decreased range of motion, and some pain issues that are limiting his function. So what we're going to do is IFC to try to decrease his pain, decrease some of that edema, and get him more functional. We're going to choose a protocol to sweep it from high rate to low rate because we want to get both endorphins, close the gate, some enkephalin release immediately to get some good therapy going on. All right, so my pre-assessments have all been done. They included the pain scale, goniometry, manual muscle testing, measuring the manual muscle testing, as well as circumferential measurements for edema, skin check, and palpation of the area. He has no contraindications. I went through those with him as well. I explained that it's expected of him to relax throughout the treatment, and then it's going to feel like the twitching of the muscle sometimes, and sometimes just that strong sensation feel of the sensory fibers. Okay, so in order to set this up, clean his skin, and I'm going to set up my quadrupolar setup with my electrodes. He does not have a specific pinpointed area of pain, so when we palpated, we found that he had a diffuse presentation of his pain that went into this area that I'm going to put my electrodes around, so right in here. Now what that means is I'm going to do a vector scan so I can have my cloverleaf pattern and hit this whole area, all right? If he could pinpoint the specific area, then I could take off the scan and just crisscross right on top of that. All right, so I have set this up on program 3 for this specific machine, which actually sweeps through the frequency of 1 to 150 from low rate to high rate. All right, so I'm going to start turning up the intensity, and what I want you to feel is muscle twitch, a very strong sensation of like little ants crawling and kind of massaging the area. Okay, so tell me when you feel it.
Feel it.
Okay, tell me when it feels like a strong sensation or little kind of twitches but not painful.
No.
Okay, all right, so is that good? Okay, so we're going to start our treatment. It's going to be about 20 minutes. So I'll give him a call button, and you let me know if it starts to hurt worse, you feel pain or burning or anything like that out of the ordinary. So come back in 5. I'm actually going to check the area, check to make sure there's no redness around their electrodes or any type of adverse reaction, that I've got good contact, and that everything is still working well for him. Okay? All right. So then leave him with the call button. Treatment's over. I'm going to turn the intensity down on my machine all the way to 0. And then off with my machine. I'm going to remove the electrodes. Okay. I'm going to clean and dry the area where the electrodes were and do all of my post assessments. Okay. So skin check, palpation and observation, a post-edema check, circumferential measurements, post-goniometer, post-manual muscle testing, asking his pain scale as well. And then I will document appropriately and then begin his other treatments.